answers are not too short or too long. Good evening, parents. We are delighted to welcome you to this informative and interactive expert led live session dedicated to raising awareness about a significant health concern in babies, hepatitis B, and the importance of 6th week vaccination. Hepatitis B is a viral infection that affects the liver, resulting in acute or chronic illness. And the most common mode of transmission for an infant in perinatal transmission from mother to her child at the time of birth or delivery. Children are also highly vulnerable to hepatitis B during the first 5 years of their lives, as it can easily be transmitted from an infected child to a healthy one. But fortunately, hepatitis B is preventable with timely vaccination, which offers protection for at least 20 years as per the World Health Organization, WHO. The first dose is given right after the birth, followed by the 6th week vaccination, and then two more doses, ensuring your baby gets all of these is which is crucial for their well-being and protection. And today, in this workshop, we will learn more about hepatitis B and why this vaccination is crucial. For this workshop, we are privileged to have Dr. Piyush Jain, who will offer some valuable insights. Dr. Piyush Jain, thank you so much for joining us today. Please share your
Thank you.
thoughts on today's topic.
Thank you, Neha. So, as you have already told in the introduction, that this hepatitis B infection per se is a very dangerous type of infection. If this infection occurs in adults, after some treatment, the infection gets cured. But if this infection is being taken up by any infant due to any cause, the most common of it is perinatal. During the delivery, the infection tends to suffer from this hepatitis B virus infection in the chronic phase. The infection gets chronic, and most of the times it leads to very serious side effects like fibrosis of the liver, cirrhosis of the liver, and sometimes even the cancer of the liver.
Thank you so much, Doctor. That was incredibly insightful. Now, before we go any further, I would like to invite all the parents once again for this live session. During this workshop, Dr. Piyush Jain will answer all your questions live to help you make more informed choices when it comes to your child's well being. Dr. Piyush Jain, so my first question to you is, what is hepatitis B and how does it affect the liver of our babies?
As I have already told you, that hepatitis B is basically a viral infection, and the most common cause in India and Asia through which the babies get affected by hepatitis B is perinatal. That is during the delivery time. If the mother is hepatitis B positive, then the baby gets this hepatitis B infection. The other sources are like blood transfusion, which is now becoming very rare after the proper screening of the blood and blood products. Then, if we get if the baby gets some procedure or some operation in the operation theater, and the instruments used, they are having hepatitis B virus, they can cause the infection to the baby. And plus, if in the adults, if they share the razors, the shaving razors, that can cause the hepatitis B virus, and very rarely it can also spread through the sex in the adults.
Of course, doctor. Thank you so much for this. Now, moving on, I have another question, and I want to understand, can a baby really get hepatitis B? How is it transmitted to other children?
I could not get the question because of some disruption in the transmission. Can you repeat?
Of course, sir. I wanted to understand, can a baby really get hepatitis B? And how is it transmitted to other children?
Okay. So, if one baby is having the hepatitis B virus infection, then if accidentally or unknowingly babies use shared toothbrushes, then the other children can have the hepatitis B viral infection. Or if they use the same nail cutter, if the nails are cut by the same nail cutter of the different babies or the different children in the house, they can get the hepatitis B viral infections. Then, if they get some needle piercing or some accidental injection, from the needle injection also, the babies can get the hepatitis B infection.
Thank you, doctor. I'm very much sure this information that you have provided really helps the mothers who are watching this Facebook Live. There are some more questions
Yes.
that I would like to ask you, but before we continue, I want to let all the parents know that we are taking the questions live here. And if you have any queries related to this topic that we are discussing today, please feel free to write them down in the comment section and Dr. Piyush will definitely address them. Now, moving on, doctor, could you please help us understand, is hepatitis B not a disease that adults usually get? And why do we have to vaccinate babies so early, like as we have discussed at the time of birth itself? Could you please help us understand this better? I'm sorry to interrupt, Dr. Piyush. If you are trying to speak, your mic is on mute. I would really appreciate if you could please unmute and
Oh,
continue.
oh, I'm sorry. I'm sorry. So, Neha ji, as we have already discussed, the disease is equally common in adults and the children. Both can be affected, and it is very common in both of the ages. The only thing is, if the adult gets this infection, they can get treated in few months of treatment. The only problem is that if the newborn baby gets infected, there are more chances that the infection will take a chronic route. The child will be infected on a chronic basis, and more than 90% of the children, they get chronic infections if they are infected in the early neonatal period or the infantile period. And ultimately, it results in the fibrosis of the liver or leading to cirrhosis of the liver, might be liver failure and liver cancers. So, it is very important to get all the newborn babies, especially to get them vaccinated within 24 hours of the birth, preferably. And especially if the mother is also hepatitis B positive, they must get vaccinated within first 24 hours of the birth. Also, if the mother is infected with the hepatitis B virus, the babies, along with the vaccination, should also receive hepatitis B immunoglobulin so that whatever virus load is being transferred from mother to the baby, that gets neutralized immediately.
I have another question which I'm very much sure a lot of parents must have. and that is to understand, can children get it? Is it possible, doctor?
Actually, your voice is not clear. Can you please repeat the question?
Of course, doctor. I wanted to understand. Can you please help us understand better that can a child still get hepatitis B if no one in the family has it?
Yes, obviously, yes. When the child is going to the school or daycare center, if they use the common nail cutter or they accidentally use the same toothbrush, they can get the hepatitis B infection. Plus, in some cases, if the child gets some injury, even mild injury, and he goes to some hospital or some clinic for some injections, and if the injection is given by the unsterile needle, even then, through that they can get the hepatitis B infection. So, definitely, everybody is at high risk of getting the hepatitis B infection. It is always better to get the hepatitis B vaccine as early as possible in the life, preferably on day one of life.
And doctor, how serious is this hepatitis B in children when we are talking about if a child gets infected?
As I have already discussed, that if the child gets hepatitis B infection, the chances of getting chronic hepatitis B are very high compared to the adults who is getting hepatitis B infection leading to the chronic hepatitis. So we have to protect our child in a very particular way, especially to get them hepatitis B vaccine as early as possible in the life. The children are very prone to go in a chronic phase of hepatitis B, and that is very difficult to treat, ultimately leading to liver fibrosis, liver cirrhosis, liver cancers, and liver uh, failure in many cases.
And doctor, what is the schedule for hepatitis B vaccine for newborn and children? And how many doses does a baby need? I'm sure this would be very much helpful for the new parents and they would
Yes, Neha ji, the newborn baby should receive the first or zero dose. Hello, are you saying something? So, Neha ji, uh,
Yes, doctor, you are audible.
okay. So, the newborn baby should get the first vaccine dose, preferably within 24 hours of the birth, to give the maximum level of protection. And I will like to add to this is that if the mother is hepatitis B surface antigen positive, then this baby, along with the hepatitis B vaccine, should also receive hepatitis B immunoglobulin within first 24 hours of the birth to protect him to the virus which is already transferred from mother to the baby. Then, according to the WHO and IAP guidelines and various other international guidelines, three doses of the hepatitis B vaccine should be given at 6, 10, and 14 weeks of life, along with the other vaccines like DPT, rotavirus, and pneumonia vaccines, which are given at 6, 10, and 14 weeks. If the child receive this vaccine at the birth, or at the 6, 10, or 14 weeks, they should receive 3 doses of the vaccine at 0, 1, and 6 schedule. 0 means today, after 1 month of the first dose, and after 6 months of the first dose. That is the standard schedule for the older children to get the maximum benefit and maximum protection, maximum immunogenicity to the children.
So, doctor, moving on, I want to understand. Suppose a parent somehow misses the birth dose of hepatitis B. So, what should they do in that case?
So you mean if the parent misses the first dose, that is the first 24-hour dose at the hospital, is it the same? If they misses the first dose, just don't worry. They should get the 3 doses of the hepatitis B vaccine, that is 6, 10, and 14 weeks. And additionally, they can receive 1 dose of the hepatitis B vaccine at 1 year of the age, which is optional and it is better to give.
And if the baby got a hepatitis B vaccine at birth, so do they still need the subsequent doses?
Yes, if the first dose is already received, then we need further doses because to boost the immune system of the baby. So whenever we are giving any vaccine to the baby, whether it is birth or any other part of life, what it does is it basically stimulates the immune system of the baby. And so that the antibodies against this vaccine antigen are raised in the body. And to get the maximum effect and to get the lifelong immunity, we need at least 3 doses of the hepatitis B vaccine at the 6, 10, and 14 weeks. By chance, if the baby has received the birth dose and could not receive the 6, 10, 14 weeks dose, they can always complete this 3 dose schedule later in the childhood. Might be at the 1 year, 2 year, 3 year, or 5 year the age. Our body has the memory cells. So after giving the first dose of the vaccine, the immunity response is there and that goes in the memory of the body. And with time, the immunity level reduces. It comes down if we do not take the next 3 doses. But suppose we take the next 3 doses after 1 year, 2 year, or 3 year of life, these memory cells get activated and our body's response, the immunity response is exactly the same and almost same as if the vaccine doses has been received at the 6, 10, and 14 week schedule. Next question, please.
So, doctor, I wanted to understand, is it safe to give the hepatitis B vaccine to the babies who were born premature?
Yes, this is a very interesting and very good question for the parents. Even if the baby is premature, the guidelines are if the baby weight is more than 2000 grams, whether it is premature baby or full term, we should give hepatitis B vaccine within 24 hours of the birth. Number one. Number two, if the baby weight is less than 2000 grams, then this hepatitis B vaccine, which is given at birth, is withheld till the time of discharge or till the age of 1 month. So, hepatitis B vaccine is to be given only and preferably if the weight of the baby is more than equal to or more than 2000 grams for the better immune response of the body. One important point is that if the mother is hepatitis B positive, we should give hepatitis B vaccine and hepatitis B immunoglobulin, whatever within 24 hours of the birth, whatever be the age of the, whatever be the weight of the baby. So in normal circumstances, if the mother is hepatitis B negative, we should try to give hepatitis B vaccine more than 2000 gram baby. But if the mother is hepatitis B positive, even at 1500 grams, 1400 grams, we should give hepatitis B vaccine and hepatitis B immunoglobulin within 24 hours of the birth.
So, doctor, some of the parents definitely have this concern that their newborns are too young to be vaccinated. According to you, how can this concern be addressed?
Neha ji, newborn baby, even the newborn baby's immune system is very well placed, very well able to handle the immune issues and the various infections which the baby can get. So it is made like this that even hundreds of bacteria or antigen, if they if they get if they give infection to the baby's immune system is developed to protect and get the immune system activated even at the day one of life. And we are just giving one antigen, that is hepatitis B antigen, which the newborn baby can take up very well. It can take up very well. So parents should not be afraid and should not be concerned and should not be confused that the newborn baby is very soft or very delicate or very soft, and if we give some antigen, the baby can get hurt. No, it is not like that. The defense system, that is the immune system of the newborn baby at day one, also very well equipped, very sensitive to take care of all the infections, all the antigens to whom it can contract. By giving hepatitis B vaccine antigen, we are just exposing the newborn baby only with the one antigen. And it is very safe, very effective, very important for life, and very much needed in today's scenario. Yes, Nehaji, next question.
So, Doctor, there are combination vaccines that we have heard about that protect against multiple diseases in one shot itself. So, I want
Yes.
to understand, do these also protect effectively against this hepatitis B that we are discussing about?
Yes, Nehaji, the hexavalent vaccine, which is available nowadays, and it is being given at 6 weeks, 10 weeks, and 14 weeks. This hexavalent vaccine contains the hepatitis B antigen, and it is very much effective and very much immunogenic. And the effect is almost the same whether we give hepatitis B antigen in the combination vaccine, that is the hexavalent vaccine, or whether we give hepatitis B vaccine separately. The main benefit of hexavalent vaccine, which is being given nowadays in various clinics, are that the number of pricks are much less than if we give the various antigens separately. Number two, the clinic or the hospital visits by the parents, the number of the hospital visit is decreased. And number three, the chances of getting the baby irritated and crying a lot after each needle prick comes down to only once when we give the hexavalent vaccine. According to the various international guidelines and IAP and various authorities, it is better to give the hexavalent vaccines at the 6, 10, and 14 weeks to give the protection against the various other diseases and also the hepatitis B disease. And most of the parents which are coming to the clinics nowadays, and even government of India providing vaccines in the various centers, government centers and dispensaries, they are also trying to give the multivalent vaccines to avoid the multiple visits of the parents, and they try to cover maximum number of the possible vaccines in one sitting, normally two or three in one sitting. So the baby's irritation is less, the pricking is less, and the parents visit to the medical center are less, time saving is there. It is really good with the maximum effects, best effect for all the vaccine antigens.
Thank you so much, doctor, for this. And now, as we have understood about hepatitis B and also about this combination vaccine, I want to understand, can giving multiple vaccines in one shot that we have just discussed, can it overload the baby's immune response? Because a lot of parents have this concern, and they also want to understand, can this combination vaccine be given along with other vaccines which are recommended at the same time?
As I have already discussed, that the immune system of the baby is perfectly ready at day one to handle any load of antigens or viruses or bacterial infections and protect the baby from those infections. And by giving this hexavalent vaccine, we are just introducing 10 to 13 antigens to the baby, which the immune system of the baby can handle very well, very effectively, and very safely. And it is really, it is really the protective power of the baby is so good. The God has given the baby such a nice and well immune system that it takes up all the antigens in a very good way, and the immune system is never overburdened by this hexavalent vaccines. And it is always good to give the hexavalent vaccine, the 10 to 13 antigens in single go, in one go. As we have already discussed, the pricking of the needle is less, cry of the baby is less, the irritability of the baby is less, The visits to the hospital are less. The time safety is more, and the time wastage is less. So it is really nice and really good to give the multivalent vaccine, hexavalent vaccine at the 6, 10, and 14 weeks of life.
Now, doctor, a lot of parents also have this concern that if their baby missed the zero dose of hepatitis B given at the time of their birth, can they still be protected against hepatitis B using this combination vaccine that we have discussed right now?
Yes, if by accident or unfortunately they have missed the birth dose, they should go for this 6, 10, and 14 week schedule with the hexavalent vaccine, which contains the hepatitis B antigen in a real good amount. And once they receive 3 doses of the hexavalent vaccine, which already contains the hepatitis B antigen, their baby is very well protected from the hepatitis B infection, and they should try to get all these 3 doses at 6, 10, and 14 weeks to get the maximum benefit, maximum protection, and maximum immune response of the baby against hepatitis B infection.
Now, I have a very common concern that I'm sure a lot of parents must be having. Is there any difference in the protection if the vaccine is given as a part of combination rather than individually? Doctor, could you please clear this doubt?
Actually, whether we take hexavalent vaccine or whether we take hepatitis B vaccine as a part of hexavalent vaccine, or we take the hepatitis B vaccine as a separate vaccine, the immunogenicity, the immune response, and the protective levels of the hepatitis B antibody are almost the same. The protection is almost the same, whether we take individual vaccines or whether we take multiple vaccine as a part of the hexavalent vaccine. And it is always better nowadays, it is always better, and nowadays it is a running trend to take the hexavalent vaccine for a better protection, better vaccine coverage, and saving the time of the parents.
And doctor, could you please help me understand how long does the protection persists against hepatitis B? Uh, how long will it last when given as this combination, this hexavalent vaccine that we have discussed during infancy?
So if we get the zero dose at the hospital within first 24 hours and 3 doses at the 6, 10, and 14 weeks, the protection from the hepatitis B vaccine is usually seen up to 30 to 40 years, and in many cases lifetime. So the protection of hepatitis B vaccine is really nice. The immune system and the memory cells of the hepatitis B antibodies or hepatitis B antigen, and the presence of the hepatitis B antibody in the body is really good and very, very long lasting, ranging from 30 to 40 years to up to lifetime in many cases.
And doctor, when is the right time to complete all the doses that protect against hepatitis B in children?
As we are already discussing, by 14 weeks of life, ideally all the infants or all the newborn babies, they should ideally be vaccinated against hepatitis B virus by the 14th week, but 6 weeks and 14 weeks. That is the ideal scenario, ideal situation.
And moving on, doctor, if you could please help us understand what if the child cries a lot or gets a mild fever after vaccination? Is that a matter of concern? Because this is the question that is very much frequently asked by a lot of parents, especially the newborn parents.
Actually, this hepatitis B vaccine is a relatively safe and with very less side effects or drug reactions. Hepatitis B vaccine causes very mild fever, very little irritability, very little crying, and very little induration or redness at the site of injection. And as we all know, this hexavalent vaccine, most of them are manufactured with using acellular pertussis, which comes under the category of painless vaccines. So, this hexavalent vaccine, which is made up of the acellular pertussis, most of the times they give very less reactions, very less irritability, very less amount of fever, pain at local site, irritability or redness at local site. So if the baby is irritable or crying a lot or having low grade fever, um, the parents can give very simple drug that is paracetamol under the guidance of their pediatrician or the treating doctor. And with mild of these reactions, parents should never stop or never interrupt the vaccination of the child, which gives lifelong immunity and safety to the child.
Now, doctor, as we are discussing about this hepatitis B, there are a lot of questions coming in from the parents who are watching this live. Should we
Okay,
start addressing them?
definitely yes.
So the first question is coming in from Ayman, who wants to understand, डॉक्टर क्या 6th वीक में वैक्सीनेशन जरूरी है? इतनी जल्दी एक और वैक्सीन? What would you
Ac-
suggest?
Actually, this is not my choice or your choice, Neha ji, to give vaccine at what age. These are international recommendations. The various international authorities and various international research government research agencies, they do where the research that what is the best time to give a vaccine to the newborn baby or the infant, and through their research we come to this conclusion that this is the best age. So, at the 6 weeks of the age, we are giving diphtheria, pertussis, tetanus, rotavirus, and pneumonia vaccines with hepatitis B vaccine. So, if we are not giving vaccine at 6 weeks of age, there are fair number of chances that the newborn will get infection due to these diseases like diphtheria, pertussis, tetanus, rotavirus, or pneumonia. So, this is not my choice or your choice or parents' choice. These are international guidelines. They are being referred for the best protection of the baby, best immune response, and for the best benefit of the baby. These are not
Of
my
course,
choice or
doctor.
your choice.
Of course, doctor. Now, there's another question coming in from Khushbu, who wants to understand, are premature babies at the higher risk of hepatitis B? She's saying my son was born at 32 weeks. What would you suggest?
Uh, as we have discussed in our earlier questions, that if the 32-week baby is less than 2000 grams, we wait till the baby attains a weight of 2000 grams, then only we give the hepatitis B vaccine. But if the mother is hepatitis B positive due to any chance, then hepatitis B vaccine and hepatitis B immunoglobulin to be given within 24 hours of the birth, whatever is the weight of the baby. So, it is not the weeks of gestation, it is the weight at birth which is the deciding factor according to the recommendations that hepatitis B vaccine is to be given at birth or to be delayed for some time. We can ask this mother what is the weight of their child, of her son or daughter or infant at 32 weeks. If it is more than 2000 grams, I think it is better to delay till the weight is 2000 grams.
We have another question coming in from Pooja who wants to understand ये वैक्सीन केवल 6 वीक्स काम करता है क्या? इसका मतलब हर 6 हफ्ते में ये वैक्सीन दिलवाना होगा? What would you suggest?
No, no, there is some confusion. As we were already discussing since beginning, we have to give a vaccine at the birth within 24 hours of the birth, then three doses in the respective schedule at 6 weeks, 10 weeks, and 14 weeks at a 4 weeks interval, which can be extended up to 8 weeks in certain special circumstances. These four doses will give protection from 40 years to lifetime in various individuals depending on the immune system of the individual. So it is not that the vaccine will give a protection of 6 weeks. If we complete this course, then the protection will be almost lifelong.
Another parent named Anand wants to understand मेरा बेबी फॉर्मूला ले रहा है तो क्या ऐसी स्थिति में वैक्सीन दिलवाना सेफ रहेगा? What would you suggest?
Both are two different things. Baby is taking feed and baby is getting immunization. So, whether baby is taking formula feeds or breast feeds, the vaccination schedule has to be followed as per government or international or Indian guidelines. That is, first dose at the within 24 hours of the birth, and next three doses at 6 weeks, 10 weeks, 14 weeks. So, whatever type of feed baby is taking, the vaccine schedule remains the same.
I'm sure this was helpful to you, Anand. Now, doctor, as we are getting a lot of questions pouring in that are pouring in from the parents, but unfortunately we have time constraint. That's why we are unable to address all the questions. However, doctor, I would like to thank you for this wonderful session. This was really insightful, and I'm sure this was very much helpful for all the parents who are watching us as well. So, doctor, just a quick suggestion. Could you please, just a quick question, if you could quickly suggest something that would be helpful for the parents related to this topic that we are discussing today?
I would like to say, आपने सुना ही होगा सबने कि प्रिवेंशन इज बेटर देन क्योर. तो प्रिवेंशन के लिए, रोकथाम के लिए सिर्फ 3 टीके हेपेटाइटिस बी के बर्थ के 6, 10 एंड 14 वीक्स पे, और हॉस्पिटल में 24 घंटे के अंदर हेपेटाइटिस बी का एक डोज. अगर हम अपने बच्चे को ये 4 डोज दिलवा देते हैं तो हम उसको बचा सकते हैं लाइफ लॉन्ग क्रिपलिंग लिवर डिसीजेस से, which includes liver fibrosis, liver cirrhosis, liver failure, and liver cancers. So it is a very simple, safe, and very good vaccines with very good immune response. So always get hepatitis B vaccine for your baby once again at the birth within 24 hours, 6 weeks, 10 weeks, and 14 weeks. Please give priority to vaccination of the baby against any other work in your life or any other celebration, going out or doing things for the baby or for your family. If you give these 4 shots to the baby, believe me, trust me, and understand this, the baby will have lifetime safety and immunity against the hepatitis B virus and hepatitis B viral diseases, and you will always be feel good. You will always feel good that in time you get vaccination for your baby for the hepatitis B virus, and your baby is growing well, and he has the lifetime immunity against the hepatitis B virus infection.
Of course. Thank you so much, doctor. This was really helpful, really insightful. And on this World Hepatitis Day, I'm very much sure this was very much helpful for all the parents. Thank you so much, doctor, for this
Thank
wonderful
you.
session. And thank you to all the parents who have joined this session. Hope this was helpful.
Thank you.